As a caregiver, I think some of you can relate to this. When you're working with somebody with complex medical issues and you're going to the hospital a lot. For me, it was somebody, my mother was elderly, she had had a stroke, she had seizure issues, she had cognitive issues, she was on a lot of medication. And I'm just gonna say it, the amount of gaslighting that went on at times with some of these doctors was ridiculous. And I understand the way the hospital systems are now, like they have hospital lists, they have like 15 minutes if they're lucky to spend with patients. I went into a hospital visit, I would like say, look, I'm with my mom 24/7, I'm a walking medical chart for her, I'm willing to team up with you and your team. If I knew there was something different about her baseline and I tried to explain that to them, well, they didn't have time to look at that, and they would say, well, your mom's just having anxiety. I don't know how many of you caregivers have heard that. Your patient's just having anxiety. I remember one time I went to the ER and my mother had a UTI. So my mother, when she had her UTI, she had seizures. So we're in the ER and I'm trying to tell this doctor, look, my mom has a UTI and they do the test, comes back negative, and my mother is having seizures in the flippin' ER. And the doctor comes back, she doesn't have a UTI. We did the test and I try to explain to him it's because I gave her antibiotic, and he literally, it discharged her and said she just had anxiety. It took four nurses to help get her in the car because she was flippin' seizing so bad. And they were sending her home with me to drive her home while she was seizing. I'm sure some of you can relate to being blown off by doctors like